Hi, this is Dr. Fareha Khatoon, Director Obstetrics and Gynecology, Cloudnine Hospital, Gomti, Nagar, Lucknow. So, vaginal rejuvenation procedures are becoming very common these days for maintaining the health of the vagina, for vaginal tightening. See, because this has become a very common phenomena after childbirth, at the time of your aging, that your vagina loosens out. So we have certain procedures which can be done for the overall health of the vagina, which will actually help in tightening the vagina. So what are those procedures? So we have these laser procedures with us, the diode laser and CO2 laser. What they do, they actually help in the collagen production and will help in tightening up the vagina. Then secondly, we have RF, radio frequency, which works on using controlled heat, which also helps in the production of collagen, which will help in tightening up the vagina. What else can be done? See, then we have, if suppose these non-invasive procedures are not effective, then we can go for the actual invasive procedure or vaginoplasty, which is actually a surgical procedure which can be done to help you tighten the vagina. Then we have PRP. PRPs are platelet rich plasmas which are actually produced from the patient's blood only. What we do, we inject the PRP in the vagina and this will help in tightening it up. Lastly, we have certain Kegel exercises or pelvic floor muscle training exercises which will help in strengthening the vagina and restoring the overall health. So vaginal rejuvenation procedures are basically helping you to maintain the overall health of the vagina, and this in turn will enhance the overall quality of life of the female.